Building a low-fidelity pudendal and paracervical nerve block model. The objectives of today's video are to demonstrate how to build a low-fidelity pudendal and paracervical block model. Additionally, we will demonstrate the technique for performing a pudendal and paracervical block on this model. We have no financial disclosures to report. The indications to perform a pudendal nerve block are that they are an effective strategy for achieving vulvovaginal numbness for the second stage of labor or complex laceration repairs. Additionally, they may also help for pudendal neuralgia or pain control after vulvovaginal gynecologic surgeries. As for paracervical blocks, these can be used to provide effective analgesia from painful labor contractions when other means are not effective, not available, or contraindicated. They can also be used for pain relief for various gynecologic procedures. The supplies needed to build our low-fidelity pelvic nerve block model are shown here, as well as in the image to the right. Other necessary supplies that can be helpful to build and use our model include a baby doll, which can be helpful to place in the vagina when practicing obstetrical paracervical blocks. Alternatively, if practicing procedures for gynecologic indications, a plastic uterus or cervix could be used. And to simulate the procedures, water-based lubricant, gel, and gloves are always helpful. And then a pudendal nerve block kit, or if a kit is not available, a pudendal trumpet, 6-inch spinal needle, and a syringe is all you need. Assuming the assembler has a drill and pudendal block equipment, building this model should cost approximately $150 to $200. All equipment can be purchased online or at a local hardware store. A silicone vagina can be 3D printed if the appropriate equipment is available. However, we purchased the one utilized in this video from a novelty sex shop, and its purchase price is included in our estimate above. With the supplies in hand, you are now ready to move on to construct the model. The first step in the building of this model is securing the pelvis to the wooden block. This can be done with 3-inch screws and washers, as seen here. The next step is adding the sacrospinous ligament, which is represented here by our 5mm rope. Additional rope or tape may be added, as seen here indicated by the arrow. This can be helpful for the next step, where we will add the cardstock, representing our sacrotuberous ligament. Next, we added the cardstock underneath the 5mm rope. This represents our sacrotuberous ligament. To create the pelvic floor, the first step is to trim the double wine bag, as seen here. If desired, additional strips of the wine bag can be cut. This can be done to represent a more robust levator ani muscle. Next, we drill 2 pilot holes at the top of the pelvis. These are used to secure the double wine bag, representing the pelvic floor, to the top of the pelvis. Note that for our model, our pelvic floor was outside of our sacrospinous ligament. This was done to allow us to palpate on the simulation that the sacrospinous ligament is anatomically found posterior to the pelvic floor. To further secure the model, We then covered it in press and seal wrap. This was also done to assure that the pieces would not move during simulations. We then added the silicone vagina. If desired, the silicone vagina can be sewn into the wine bag. This can be done to further secure the model during task training sessions. Next, the fetus was added. Alternatively, a plastic uterus or cervix from a gynecologic skills trainer can be added to the model instead of a fetus. This can be done to practice pudendal and/or paracervical blocks for gynecologic indications. After adding the fetus or cervical model, our construction is now complete. We are now ready to practice pudendal and paracervical blocks. We will now demonstrate how to perform a pudendal nerve block on our model. To perform a pudendal nerve block, begin by palpating the spinous process. From there, move medially about 5 to 10 millimeters along the uterosacral ligament. This is where the local anesthetic agent should be injected. For our pudendal nerve blocks, we prefer Marcaine. However, if this procedure is to be done in tandem with obstetric paracervical blocks, then Marcaine is contraindicated. In this case, lidocaine or epivocaine is preferred. Next, we will demonstrate how to perform a paracervical block using our model. To perform a paracervical block, anesthetic agent should be injected at the 4 and 8 o'clock cervical positions. Additionally, 2 fingers should be placed between the fetal head and the trumpet to prevent injection into the baby. If this procedure is being performed on a laboring cervix, the anesthetic agent should be injected 2 to 4 millimeters deep into the tissue. This is in contrast to gynecologic indications, where the anesthetic agent should be injected 5 to 10 millimeters deep. In this video, we demonstrated how to build a low-fidelity pudendal and paracervical nerve block model. Additionally, we demonstrated how to perform pudendal and paracervical blocks on said model. We appreciate you for taking the time to watch this video.